Mental health challenges are common during and after pregnancy. You might notice some symptoms of depression, anxiety, or other mood changes. This can be confusing and disappointing, but you should know that it is very normal. There are safe and effective treatments for these health conditions. It helps to learn the signs and talk to your OB/GYN about how you are feeling. First, let's talk about depression. You might have heard of the baby blues, which are normal feelings of sadness after childbirth that get better within 2 weeks without treatment. But if you feel sad most of the day, nearly every day, for 2 weeks or more, you might have depression. Depression during or after pregnancy is called perinatal depression. After pregnancy, it's called postpartum depression. Signs of depression include feeling hopeless, worthless, and guilty. You might lose interest in activities you used to enjoy, have changes in appetite, have trouble concentrating, have a hard time sleeping every night, and feel tired all the time. You might also think about death or suicide. If you feel like you want to harm yourself or others, call the Suicide and Crisis Lifeline right away at 988. You can also contact the National Maternal Mental Health Hotline for support at 1-833-TLC-MAMA. Now let's talk about anxiety. Anxiety during or after pregnancy is called perinatal anxiety or postpartum anxiety. Anxiety is when you feel a constant worry. You might feel restless, irritable, and tense. You might also have trouble sleeping and concentrating, and you might have a rapid heartbeat, dizziness, or chest or stomach pains. Anxiety often happens alongside depression. Some of the symptoms can be similar. Other common mental health conditions include obsessive-compulsive disorder, or OCD, and post-traumatic stress disorder, or PTSD. OCD causes recurring, unwanted thoughts and urges to repeat specific behaviors. PTSD causes anxiety symptoms after a traumatic event, like nightmares, flashbacks, and sleep problems. Tell your OB/GYN if you notice any of these signs or other changes in your mental health. Getting help is the best thing you can do for you and your baby. Treatment can help you feel better, have a healthier pregnancy, and take better care of your baby. Treatment can involve talk therapy, medicine, or both. There are medications that work well and are safe to take during pregnancy and while breastfeeding. Your OB/GYN can prescribe medication and refer you to a therapist, or they might suggest you see a psychiatrist to discuss more medication options. Self-care steps like doing what you can to sleep, exercise, and eat healthy food can help too. If possible, ask friends and family for help so that you can find a little time for yourself. It can also help to join a support group. You can look for pregnancy and postpartum support groups that meet in person or online. If you get help for a mental health condition, there are lots of benefits for you and for your baby too. Treatment makes it easier for you to take care of yourself and stay healthy. You may be less likely to give birth early and less likely to have a baby with a low birth weight. You may also have an easier time bonding with your baby and finding joy in this new phase of your life. Remember, asking for help is the first and most important step. With help, you can get the treatment you need to start feeling better.